Good morning, everyone. Scott Maybor here with your Medicare Missive from the pond for Tuesday, the 12th of May. Hope you're all doing well. Today, I wanted to talk to you about provider networks. So I think one of the most confusing and unfair parts of the Medicare system is the networks. I have an email here from a colleague who had sent it to me on Friday and was complaining about the loss of another network in a carrier's network here in Massachusetts. So networks are very important. When I'm talking to a client about Advantage plans, my order of thought process is who's in the network, because your doctors that you currently see and presumably want to continue to see have to be in network. And this is coming increasingly important. I'll explain why. Then your medications, and then the and then the co-pays and max out of pocket, and then the ancillary benefits like dental and gym memberships and stuff. But I always put the network first. What's happening now, and why I think it's inherently unfair, is that as the plans are cutting back and they claim they're losing money and so on and so forth, one of the areas they're cutting back is reimbursements to the hospitals and the providers. Many of them are reacting by simply saying, you know something, you're not paying us enough, get out. The problem is, and where I think it's inherently unfair, is that you, as a beneficiary, get to choose one of these plans, and we're talking primarily Advantage plans, or exclusively Advantage. Well, no, let's say primarily Advantage plans. You, as a beneficiary, have a window to choose an Advantage plan, either open enrollment or annual enrollment. So either 10/15, October 15th to December 7th, or January 1st to March 31st. Once that's gone, unless you meet some very strict criteria like you move, the fact that that the reason you chose Plan A for, your doctor or the hospital network has decided to leave the plan in the middle of May, you're up the creek without a paddle. You're stuck. So one of the greatest things about Medicare is that you're picking an individual plan. Unlike when your employer picks a plan and they pick a plan, and if your doctor's not in it, you have to scramble and find a new doctor. With Medicare, I would argue one of the best things about it is you pick your plan. You have complete say over what type of plan you get. The problem is we're picking a plan based on information available to us in October and November. And then in May, they renegotiate a contract and pull out. So they say, you know something, we can't come to terms, we're pulling out. And where does that leave you as the beneficiary? Stuck. And I think that's inherently unfair. There is talk of changing that so that if your primary care leaves the network, you would have an enrollment period to change plans. And I think that makes a lot of sense, because the only entity of not the hospital or the doctor, not the carrier, but the beneficiary is the one that's stuck. It's the same thing with drug coverage. If there's a change in what's covered or manufactured even, you're stuck. I would argue that should give you an open enrollment period to make a change. If you have, and this is becoming increasingly problematic, one, as the carriers are becoming, claiming they don't have any money and they're cutting back on reimbursements. A lot of the providers and networks are simply saying, you know something, we don't need you. You don't pay us enough. The other problem is there's a big push or move away from HMOs to PPOs, from PPOs to HMOs. So if you have a PPO, you can go out of network at higher cost, but you can go out of network. So if your doctor were to leave the network, you could still see them. If you have an HMO, that is not an option. You can only see in-network providers. The PPOs, especially the zero premium PPOs, are becoming increasingly rare. Typically, they're only being offered by either small carriers to attract business, or they're being offered by a specific network. So here in Massachusetts, Mass General, so the Mass General Brigham network, is not accepting United Healthcare or Blue Cross for primary care. Now, if you have a PPO, you can still see your primary. You pay more. If you have an HMO from either UHC or Blue Cross, you cannot go there, period. You pay cash if you go there. Not an ideal situation, and they announced that beginning of October last year. So be aware of the network. Now, if you have a Medigap plan, there is no network. If the doctor takes Medicare, they're required to take your plan no matter what plan you have. So you could have the Scott Mabor Medigap plan and they've never heard of it and no one ever has. It doesn't exist, by the way, but they have to take it, period. That is a huge argument, in my opinion, for Medigap plans. The other thing is the MSA, which is the plan I mentioned for the self-employed and business owners. Another fabulous plan, doesn't have a network, so you can go see anybody. But for those of you on Advantage plans or interested in Advantage plans, be very aware of the network and pay attention to letters and emails from the carrier about changes in network, because it could negatively impact you. Let me know if you have any questions or thoughts. Thanks for watching. Have a great day. Appreciate it.